Welcome back. Malaysia is moving towards a national health financing or medical insurance scheme with a white paper expected and implementation targeted around 2027. The aim is to rein in rising healthcare costs and make coverage within that more affordable. But for patients, especially those facing serious illnesses, the real issue is not policy language, but access, clarity, and whether the system actually works when it matters most. Well, Dr. MURALLITHARAN MUNISAMY is a public health physician and managing director of the National Cancer Society Malaysia. He has to date spoken openly about how insurance structures can delay care and shift costs back to patients. Tonight, or rather today, we ask what a national scheme must get right and what happens if it doesn't. Dr. Murali, thanks for joining us. I know you're out and about and we've caught you perhaps at a good time as well. From what you see on the ground, is the current insurance system serving patients or is the system failing them?
Good afternoon. Thank you so much. Always a pleasure to be live with Bernama. I think the major thing that we're looking at in this new kind of transformation of the insurance scheme is this movement away from this fee-for-service idea, where I do X and I get paid Y. So in the new kind of transformation that Bank Negara and Ministry of Health, all the players are working towards, what we are hoping to be able to do is move to a value-based outcome or kind of a bundle system where an entire kind of process or a procedure is built under one bill, one cost. And we are hoping that in doing this, we can lower the cost of how much people need to pay for insurance, because the cost of how much insurance is paying out to healthcare organizations will also reduce.
Mm-hmm. Well, you've highlighted how costs are often shifted back to patients. How serious is this problem in today's climate, given cost of living and as well as the issue of access?
I think you hit both the nails on the head at the same time. One is insurance is becoming so expensive that the average Malaysian who is in the middle income bracket, forget about lower middle income, in the middle income bracket is no longer able to pay for the cost of premiums. And this is really because of the rising costs. Just because everything costs more in healthcare and healthcare inflation is so high, what is then happening is this is immediately being transferred to the client, in the sense that at the final end, like at the end of the day, because the costs or the entire, everybody is being charged a lot. Premiums, the insurance industry as a whole is just increasing premiums every year on year, actually, to be able to cope with this. Bank Negara came in with a little, I think, speed breaker last year, but they can't hold off on this kind of big increase of premiums any longer. So we really have to get a reset. I think that's what we're hoping to be able to do with this entire initiative.
Mm-hmm. For conditions like cancer, timing matters, and then when you talk about being held back by factors like affordability and access for a patient who has cancer, this of course is crucial. Do insurance processes today help patients move faster, or does that red tape within the processes slow them down?
So again, and here's where we're hoping things will change a little bit. Currently, because of the kind of very intricate complexities around diseases like cancer, where you see, it's not like buying nasi goreng USA, for example, where every nasi goreng comes with a sausage on the side and then fried egg. The problem is with different cancer conditions, even within the same cancer, different patients will need different types of treatments or different types of investigations. And what happens is, there is this, because this complexity arises, the way insurance is structured now, every time they have to ask permission from the insurer whether or not this procedure can be carried out or this investigation can be carried out. And then insurance takes a while to come back with the answer yes or no. And in the meantime, the patient is waiting. And the waiting period is not hours. Sometimes it stretches into weeks. I think we were learning recently of a case highlighted in the media where it has taken more than weeks.
Doctor, with the government now proposing a national scheme, what do you think is the one thing it needs to get right to truly improve access? Of course, there's a lot of effort surrounding this and the rollout in terms of messaging and outreach. But what does this scheme need to get right for a national approach?
For sure, one of the key things that we have to do is lock the kind of mechanism of how we are paying for services. So under the current scheme, this we have to get right, because under the current idea of how insurance is being reimbursed to healthcare providers, okay, we reimburse them on a per item basis. Every time something is done for someone, and then they claim it out of insurance. So you may do in one admission 200 or 300 things to a person, or 50 things to a person, and then correspondingly those kind of charges apply. So what we are trying to do is move to something called like a bundle. Yeah, I mean, I'm simplifying this, of course, but right, like a bundle where you pay for like a package. And inside this package, everything else is covered. So that is something we need to get right, because that needs to be a fine balance between making sure that we are paying enough to the hospitals to get those procedures done, but at the same time making the cost still affordable enough so that premiums can be priced within the range of the middle-income Malaysian.
Okay, so now hospitals are already under pressure as it is, given our healthcare ecosystem and, as you've mentioned, the inflation within healthcare, that rising cost. If more people depend on a national scheme, can the system realistically cope?
So, this is where really the government needs to be able to come in to either subsidize this or support this. What do I mean by this? So, for example, if we start moving patients, if patients start subscribing to a voluntary health insurance program, and which is what is being rolled out, there'll definitely be movement out from the public sector into the private sector. With a lot less volume, maybe the government can look at subsidizing premiums for Malaysians who are buying this and using it in the private hospitals. Next could be something like, for example, even making increased affordability of the raw items. For example, we're buying drugs at a certain rate now. Can the government then come in and, for example, of course, some of these are not like short-term options, they're medium-term options, subsidizing the cost of products so that they can then be given to patients at slightly lesser prices. So these are things that come into the cost containment mechanisms that the government needs to actively look into as well, if it genuinely wants to make sure that we have a sustainable marketplace, a sustainable mechanism in which patients and hospital providers are able to exist.
Right, and with every reform, every new implementation, it is that deployment that will really ultimately matter. If this reform is poorly designed, who will ultimately pay the price? And what does it now and all look for towards the ordinary Malaysian, for people like you and I?
So I'm going to be a little cautious, Jessie, and before I go into this deployment idea, because that's exactly one of the big kind of false expectations that all of us are having. I don't think the system is going to work from day one. I think it's going to be a painful process.
It's a bold statement, Doctor.
Yeah, it's going to, because it's a highly complex solution that we're trying to attempt, something which people have been trying to attempt for maybe the last 30 years or so and failing. So I'm happy that finally the Ministry of Finance, Bank Negara, Ministry of Health, everybody's kind of pulling their resources together and going into this. But Malaysians as a whole need to be cautiously expectant, in the sense that these is going to take time. As they roll it out, there'll be mistakes. There'll definitely be screw-ups. All this is bound to happen, but these teething problems we need to ride out, and then we'll get a system that works. Our problem is the average Malaysian wants to get married at 5 o'clock and have 3 children going to university by 7 o'clock. And that's our expectation now. So that is, I think, where we need to align this as well.
All right, that is some speed up time machine right there. Doctor, I want to thank you for weighing in and sharing with us your perspective on this reform. We'll speak to you again. Well, there you have it. Let's take a quick breather. More global business updates continue right after the break. Stay tuned.